She did really good.
Mm-hmm.
Good morning, folks. We'll give people just a beat or two to hop on, and then we'll get started, but we're glad you're here, and we'll get going in a minute or two. Well, it's a little bit after 9, so I'm going to get us rolling here. I am Kate Bowles. I'm the president and CEO here at the Community Health Endowment. We're really glad to have you all join us this morning. I'm joined here by Morgan Hermanic, who's our operating and communications officer. We're going to tag team this presentation for you. We're really pleased and excited that you're here. We have several new things to share with you, and we think there'll be great new opportunities for partnerships in the coming year. So I'm going to dive right in, but I will encourage you to stop me and ask questions as we proceed here. So the Community Health Endowment's mission is to make Lincoln the healthiest city in the nation. We were founded with the proceeds of the sale of Lincoln General Hospital and remain committed to health in the city and really focused on the Lincoln community. Today's presentation will cover our funding approach, a little bit about our approach to data, and a deep dive into the application process. I'll note that today's presentation is interactive. You're welcome to stop me with questions, stop Morgan with questions, pop questions into the chat, follow up afterwards with emails. We're here to help. We will be recording, and I do just want to note that I saw several note takers pop into the admissions. Just so you're aware, it looks like there are some folks that are taking virtual notes at this presentation. And then there is closed captioning capability. If anybody has a question about setting up closed captioning, pop it in the chat and we'll try to help you get set up. There is a little note here about where to find closed captioning if you need it. So under record and transcribe, language and speech, and show live captions. So what does the Community Health Endowment fund? We fund nonprofits doing work in Lincoln that is focused on one or more of our funding priorities. And we do have 3 new funding priorities this cycle. The first is access to healthcare for targeted populations, including understanding of and access to primary care physicians and insurance for populations where disparities exist, particularly partnering with representative community members. Access to healthy food for targeted populations that face health disparities, and mental health access for targeted population, including increasing awareness of and access to mental health services. So what do we mean by targeted populations? Targeted populations are considered groups of people that data show face disparities or barriers to health, as evidenced in Place Matters, Lincoln Vital Signs, the Community Health Assessment, or local data sources. CHE particularly values projects that demonstrate deep impact, leverage additional funds, address disparities, and build partnerships. I want to pause here for just a minute and say a little bit more about what we mean by targeted populations. So first is just about any population that, sorry, I'm getting ahead of myself here. Just about any population that faces a disparity to accessing health, as long as you can justify that with data, would qualify. For example, data shows that individuals with disabilities disproportionately experience poor mental health days. So as long as the data shows that a population of individuals with disabilities have a barrier to mental health, that demonstrates what we're looking for in terms of an application. If you have any questions about that, you're welcome to sign up for an idea meeting, which we'll talk about a little bit later, and we can talk you through some of the ins and outs. I would also want to share here that that CHE values projects that demonstrate deep impact, leverage additional funds, address disparities, and build partnerships. Of course, we want projects that are practical and make sense for you and the population you're serving and the organization that you serve. Demonstrating leveraging funds is always helpful. It's not required, but it does help the board know that you have identified additional resources to help make your project a go. Demonstrating deep impact can mean a lot of things, and we do have some flexibility there. What I want to share about that piece is that demonstrating deep impact doesn't mean that it has to be citywide. It doesn't mean that it has to be a project that's evidence-based. You could go deep with a small new project. You could go deep in a particular neighborhood. You could go deep by demonstrating proof of concept for something brand new. What we're not looking for is simply serving more people in an existing program that only adds marginal value. We're also funding something new this cycle, which is a technical assistance program pilot. So we have a small pool of funds, about $50,000, to particularly focus on applications related to technical assistance. Projects might include planning, evaluation, or training. And the idea is that will help to strengthen your long-term capacity to serve the people in our community. Typically in the past, CHE has funded either programmatic grants or capital construction grants. This opportunity offers organizations the chance to apply for something that might just strengthen your organization, making a long-term strategic plan for a project or program, evaluating the success of something you've initiated in recent years, training your staff on something like resilience or best practices. Those kinds of things are a little bit harder to find funds for, and that's what this pool of funds is specifically for. There is a separate application and it's available on our website. We fund 1, 2, and 3-year grants. It is your choice as to how you put your application together. If you have a 3-year vision, we welcome a 3-year application. If you're demonstrating that you want to give something a shot, a 1 or 2-year grant might make more sense for you. That's your choice. We do fund capital and equipment expenses. Those require a 1-to-1 match. And we do fund indirect costs. You can bake up to 15% of the grant request into your budget. We do not fund individuals. We don't fund original research, though evaluation and quality assurance are allowed. We don't fund lobbying, political parties, or debt reduction. We often get the question, how do we choose? CHE is led by a 15-member board of trustees in healthcare, human services, and the financial industries. They make the final choice. The board has an interest in projects that promote health equity, and a data-driven approach is valued. But really, at the end of the day, the funding committee, which is a subset of our board of trustees, reviews all the applications, often asks follow-up questions, and makes the final selection for which grants will be funded. A few examples of funded projects include the Asian Community and Cultural Center, which is doing great work expanding prenatal care services for refugee and immigrant clients. We have a great project with the Food Bank of Lincoln to purchase fresh produce and distribute it through a local neighborhood distribution, the Healthy Fresh Food Truck. And we just funded a new project called At Ease USA, which provides peer support and wellness programming to veterans at risk. So each of those is an example of one of our funding priorities. The Asian Community and Cultural Center, I think, is an example of what we might fund under healthcare access. The Food Bank of Lincoln project is an example of what we might fund under our Healthy Food Access project. And At Ease USA is an example of a mental health access project. Each of these is focused on a targeted population. For the Asian Community and Cultural Center, that's refugee and immigrant clients. For the Food Bank of Lincoln, that's targeted geographies, places where people might need access to healthy, fresh foods. And At Ease USA is focused on the targeted population of veterans, particularly formerly incarcerated veterans. As I mentioned, CHE has a focus on health equity and targeted populations. Health equity is defined by the CDC as the state in which everyone has a fair and just opportunity to attain their highest level of health. And targeted populations, as we've mentioned before, are folks who face barriers or disparities in health evidence by place matters, vital signs, community health assessment, or other data sources. And later in the presentation, we'll share this as well, but those resources are posted on our website. We certainly are open to a variety of data sources, including data collected from your organization. But we do want to share a little bit about Place Matters, which is kind of our go-to data source. It's a publication that CHE produces. If you're not familiar, it's available on our website, and we're happy to answer questions about it. But it's really a place-based analysis of health access, health outcomes, and social determinants of health in our community. So, for example, this is one of the maps we produce. It demonstrates where the greatest concentration of people living in poverty are in our community. And you can see by the color coding here that the greatest concentration of folks who are low income is in the center of the city, the core of the city. Another example map is the overlap between poverty and the concentration of minority individuals in our community. There are several census tracts demonstrated in purple here, where we have both above average poverty and above average minority population, which tells us there might be some ways and opportunities for us to target individuals in those areas who might be experiencing greater need and greater barriers to accessing health. We also produce a map called the Social Vulnerability Index, which is a roll-up of 4 categories and 16 data indicators that roll up into what we call social vulnerability. It's a combination of socioeconomic, household composition, minority status, and housing type and transportation indicators. And you can see here that social vulnerability in our city is concentrated up and down the Cornhusker Highway corridor, as well as in the core of the city and north and south of the university. So those of you who might be considering a place-based approach to an application might take a careful look at this map. Prenatal care is another data point that we like to share. We're working with the Lancaster County Health Department and other partners towards a community-wide goal of at least 80% of all women accessing early and adequate prenatal care. And you can see there are several census tracts where we've achieved that goal and several census tracts where we have a ways to go. And so those of you thinking about healthy women and babies might take a careful look at this map. This is our healthy food access map. It's done in partnership with the City of Lincoln and the Nebraska Extension Office, and it demonstrates where it's easier and harder to access healthy foods. One of the things that I think is great about this map is that the core of the city, where other maps have shown that we have a concentration of poverty, we actually have fairly high healthy food access, and that's a real positive thing that comes out of this map. So those are just some examples of data sources that you could pull from to help make the argument for your initiative or project. The data that we use to develop our funding priorities can be found on our CHE website, and the link is available there. We took a look at Place Matters, the Community Health Improvement Plan, the City Health Dashboard, Lincoln Vital Signs, and others. So I'm going to pause for a minute and stop sharing and see if anyone has any questions at this point before we turn the corner and give the reins over to Morgan about the application process. Is there anything I can answer about our new funding priorities, our data interests, or anything else about our organization, mission, or approach?
Hey, this is Michelle Johnson, and I'm wondering, with those 3 applications, is it possible to cross-match applications?
Sure. So we've done it both ways in the past, and at the end of the day, what ends up happening is that we as staff members just end up making a judgment call about which category you're mostly in. And that's because the board tends to like to look at applications in each funding category at the same time. So we really just encourage you to make a choice about what your primary priority is. Good question. Okay, feel free to drop other questions in the chat. And with that, I am going to turn the reins over to Morgan.
Hi, sorry, I have a question. I'm Joanna Kalel, and I was wondering if you had, you mentioned program and capital for funding. Would you also be open to operations requests?
So up to 15% of your application can be overhead or administrative, but generally we don't fund kind of blanket operations requests. We tend to be either programmatic capital or, as I mentioned, the new opportunity. We do have some technical assistance funds available.
Okay, thank you.
Mm-hmm. Okay.
Perfect. There's not any other questions. I'll go ahead and get started. Like Kate mentioned, feel free to drop any that you think of in the chat. We're somewhat new to Teams, so I just want to make sure that you all only see my PowerPoint slide. Is that correct? Can I get a thumbs up? Okay, perfect. So let's start with the application process. Here is the beginning of our little infographic describing what you can expect when you apply for a grant with the Community Health Endowment. The first step is the applications open. Those opened yesterday on our grant portal, which we'll walk through here in a minute. Then we have the applicant workshops, which you all are a part of. We have the eligibility form, which is required for both of the fall application and the technical assistance grant application. We have optional but highly encouraged one-on-one idea meetings, or one-on-two, or however many people from your organization want to join. And then the applications are due. We'll walk through the additional steps in the grant life cycle after we cover these. So the grant portal we use is called Foundant. So if I use that word throughout this presentation, that's what I'm referring to. You can access the portal through our website, ceglincoln.org. I'll bring that up in a little bit to show you exactly how you can find that. If your organization has not applied for a grant, I ask that you please create a new account. It's a pretty easy step. You enter your organization name, address, phone number, EIN, and that's about it. You can create your account. Existing organizations, if you have applied before but you've forgotten your password, there's a forgot password link. And then the tricky part is if you already have an account, but maybe with a different organization. I know there's some people on this call that have maybe applied for grants in the past. Give us a call, send us an email, and we'll reassign you to the new organization. That way you don't have duplicate accounts. So the first step in both applications is the eligibility form. This is just a very brief form that gives us all an idea of what it is you're wanting to apply for, and is the first step before you have an idea meeting with CHE staff. There's just a small amount of questions, including your geographic focus, since we can only fund projects within the city of Lincoln, your organizational eligibility, confirmation that you've not violated state or federal law, selection of eligible funding priority, and then there is a space, short area for you to describe your project idea. And whatever your project idea is in your eligibility form doesn't necessarily have to be what you end up applying for. That's what your idea meeting is. That may change a little bit along the process. Our board of trustees are actually not given the eligibility form. They're only given your grant application. So the eligibility form is just viewed by staff to help prepare for the one-on-one and provide any support that you may need. After your eligibility form has been reviewed, staff will reach out to you via email regarding your eligibility. And at that time, if you're eligible, you'll receive a link to sign up for an idea meeting through Calendly. So these are just 30-minute online meetings with CHE staff. They're not required, but I will say they are highly encouraged. And this meeting is to discuss your idea, to help think through maybe what the Board of Trustees would be most interested in, to decide maybe if there's a partnership in the community with another organization, how you may leverage funds, just anything staff can think of to see if you'd be a good fit and how to make your application stronger. Kate, do you have anything to add about idea meetings?
My only suggestion here is if you are generally intending to apply, the board does like to hear that you've done an idea meeting, and I would encourage you to just sign up for one. If it ends up being 10 minutes and we hop off quickly, that's just fine. But especially towards the end of the calendar cycle there, towards the middle of July, those meetings fill up really quickly, and I can't always say yes to folks who come in later. So get yourself on the calendar now.
Mm-hmm. Yep, and just a quick reminder, you do have to fill out an eligibility form to be sent the link to sign up for our one-on-one. So we encourage you to do that, like Kate said earlier, rather than later. So the application's available on the CHE grant portal. I will review that here in a minute. So we ask that you choose your main contact of your organization carefully, because this is the person that will receive all of the system emails, including the approvals, denials, report reminders, updates. If you have a general email, a lot of organizations have emails such as grants@cedars.org. Just make sure that that's being monitored, because you'll be receiving reminder emails and you don't want to miss anything. Other users can be added as collaborators, and they'll get a notification of that. They can be set to be able to just view an application or a follow-up form, edit it, or they can submit it as well. So you're welcome to share this with anyone who's working on your application or who you want to review it, including a consultant, grant writer, partner, maybe you're leveraging other funds or partnering with another organization. You're welcome to collaborate in that way as well. But you do have to have a single main contact. If you're unsure who your main contact is or you need to switch that, just reach out to staff and we can help. So as part of the grant application, you do have a work plan. You're required to use the CHE template, which can be downloaded from the grant portal application directly. We encourage you to be specific and include intended outcomes, activities, and timeline. The work plan template does have an example. So that first part you see that's all filled out is an example of what we're looking for. We just ask that you start with clear goals to really define what you want to achieve in simple measurable terms. To break the goals down into action steps, so listing the specific tasks that are needed to reach each goal, such as train 5 community health workers or host 3 prenatal education sessions. And then assign responsibilities, so clearly state who will do that, such as the outreach worker will recruit the participants. And then just set a realistic timeline. So, sessions will be held April through June. I will say, in terms of the timeline, things can change, especially for multi-year grants. These aren't necessarily set in stone, and if your application is approved, sometimes you need to submit a revised work plan. But just fill this out to the best of what you know currently about what you're hoping to accomplish with the project. Anything to add on the work plan, Kate?
Nope.
So the budget, we also have a CHE template. We ask that you complete both the support tab and the expenses tab. There's 2 in 1 Excel workbook, and you'll need an Excel workbook for each year of funding requested. So if you're requesting 2 years of funding, you'll upload 2 separate Excel sheets, and so forth. And then there's also a section on the actual application itself to add any explanation about the budget that you need or that you think needs clarification. Here's an example of the budget template. There is let's see, this is the support tab. So the total requested from CHE is at the top. Anything that's in gray is a locked cell. You cannot fill it out. So only think about the white cells. It looks a little complicated. It's not once you get in there, because a lot of it auto-populates for you and calculates what you're going to need. For other support, this is other support for the program itself. So not for the organization as a whole, but if you're funding a program or a capital campaign project and you're expecting other support from cash commitments or even in-kind donations, go ahead and include that in the other support. You want to make sure that every line is aligned with your project goals. So if there are things in the work plan that the budget doesn't necessarily address, even in the other support, the board might be curious about that. So if your work plan says you're going to provide, 100 healthy meals for kids, and you're asking for money to rent the space to do that, I'm just giving a random example, and you don't include anything in the budget about how you're going to pay for the meals, the board's going to wonder who's partnering with you on that, who's doing that. So make sure you fill in the support. Anything to add on budget, Kate?
No, but I'm going to verbalize 2 questions that came up in the chat.
Yes.
One was just to clarify, eligible applicants are nonprofits, government institutions, educational institutions, tribal entities. We can work with fiscal sponsors, but for-profit organizations are not eligible to apply. We have seen partnerships where a nonprofit will be the lead and they might subcontract for a training service, for example, from a for-profit entity. So there are ways to work with partners, but your lead entity needs to be nonprofit or government or educational service. The other question, which was a great question that I want to lift up, which is, can you apply for both the regular funding cycle and the technical assistance grant? And the answer is absolutely yes. We'd encourage you to. If you've got an idea for both, we'd love to hear them.
Thank you, Kate.
Yep.
So the last template needed for your CHE grant application is a letter of commitment, which I should clarify are optional. They may not apply to every single grant, but it does help your application, especially if you note in the narrative that you will be partnering with other organizations. This is different than a letter of support. So a letter of support is a letter from someone in the community or a partner who says, this organization is doing great things. We love them. They have a huge impact. A letter of commitment is more of a binding promise for specific action of resources. So let's say, my earlier example of providing healthy foods to kids in a community space, maybe you have a letter of commitment from the organization whose space you'll be utilizing. And they say, yes, we support this project and we're willing to provide our space for them to serve these healthy meals. That would be an example. We do ask that you use our template again, instead of a letter in their own format. That makes it easier for a board of trustees to review them fairly and accurately. So again, just to reiterate, the letter of commitment identifies a specific commitment to the project and not just general support for the agency. Here is an example of the template. You can provide up to 3 letters. Again, they're not required, but if you do note partnerships or leveraging of funds or anything like that, and you don't include a letter of commitment, I think that might be a missed opportunity. So just something to consider. So we're going to jump back to the infographic on the grant life cycle. After you submit the applications, this cycle is due July 31st. The CHE Board of Trustees carefully reviews each application, and we will contact organizations if they have follow-up questions, and they often do. So just keep a lookout for any emails or phone calls you may get if you do submit an application. Then the applicants are notified. The timeline for the specific application grant cycle is on our website. So each cycle, the timeline may shift here and there, but generally it's 2 to 3 months after the grantee or the applicant will be notified of an award decision. Contracts are then drafted and signed through DocuSign. And then proof of insurance is submitted. We're required, since we're the city of Lincoln, for proof of liability insurance. Those requirements will be included in the award winner's application or their award letters and their contract. And then the grant period begins. So this grant period begins January 1. After that, there's a grantee gathering at CHE for all of the new grantees to meet one another, build partnerships, and learn how to submit CHE forms and submit grant payment requests and answer any questions that they have. And then we go into the actual, the fun part of the grant, doing the work and hearing about all the awesome work you guys are doing in the community. So this is through quarterly reports done through our grant portal. Sometimes the Board of Trustees and or staff will visit the project to see what's happening, answer any questions that the trustees have, answer any questions you guys have, address any concerns, just give general praises. Some projects make more sense to do a site visit than others, but I did want to put that on your radar. And then finally, grants are closed at the end of the grant cycle period. Sometimes this can be 1 year, 2 year, or 3 year. And we do have grants that are extended. So grantees are not necessarily required to spend down the money. It's not use it or lose it necessarily. Our grant officer and Kate really want to work with you to make sure that the work's being done according to the contract and the money's being spent according to what the Board of Trustees intended it to be spent on. And sometimes that does include an extension. So I also wanted to flag that if you're new to CHE. Okay, I am going to do a live walkthrough to show you what this looks like. Stop sharing. Okay, so this is our website. You all probably visited our website when you registered for this new applicant workshop. The funding information is found under funding. Here you have our funding priorities, current funding cycle, technical assistance grant, and then information for current grantees. There are links on almost all of these pages to get to our grant portal. One of the easiest ways is just to go to the menu. I've heard that called the hamburger. So the hamburger menu. Here is our lovely grant portal. I'm going to go ahead and log in under my test so you could see what this looks like upon login. So this account does not have any active grants. There's a couple under historical, which were all tests. To apply, you go to the apply button, and this is what our 2 grant applications look like. I just saw another question, Maggie, in the chat. It's been addressed, but yes, you can apply for both grants if it makes sense.
My question, I'm sorry, my question was.
Go ahead. I got you.
Oh, okay, great.
They're two separate applications. So
Okay, thank
no, you cannot embed one into the other. You can apply for a project or a capital grant through the fall cycle. If you specifically want to do planning evaluation or training funds, go ahead and apply through the technical assistance grant cycle. If you want to talk that through further, we can do that in an idea meeting.
Wonderful, thank you.
Mhm.
Thanks for the clarification, Kate. I missed the last part of that question.
It's okay. It's fine.
So this shows that these are two different applications. We have the fall grant cycle, then we have the technical assistance grant cycle. You can click see more and all the information you need comes up, click apply, and that's actually how you begin the eligibility form. This explains that as well. So sometimes it can confuse people because the eligibility form is within the application itself. That's okay. It's not binding you to an application. Go ahead and click apply. Let me show you what that looks like. I'm also going to click preview. This will download the sample questions for you, which we'll revisit in a second. I'm going to click apply. This is the eligibility form, just those few questions we talked about earlier. You'll click submit application, and that's submitting your eligibility form. What happens is staff will review it. You'll get sent an email. And then if you're eligible to apply, we will reopen the application for you, and you'll be notified that the full application is now available. You can log back in and go to the draft form and continue completing your application. This is the question list for the application. It comes up differently in the PDF. It'll be formatted the same as the eligibility form with the fill in the blanks. There'll be links to click to download the work plan, the budget template, the letters of commitment template. We'll go ahead and have you work through this. If at any point you have any questions or you run into errors, please give us a call. We will walk through it with you. We have links to the glossary of terms, links to place matters, links to each funding priority. While all this information is available on the website, it is helpful to include here, especially if you collaborate with any others who may not have come to this grant portal from our website. That way they have all the information they need there. We talk about the project summary, number of people impacted, health equity, and which targeted populations you'll be serving, which Kate talked about earlier in this presentation. Kate, do you have anything to add about these earlier narrative questions?
No, I think you covered it. We do have a question from the chat. Do we need to fill out 2 eligibility forms if we were applying for both grants? I'm not sure how you set that up, Morgan.
Yes, you do. They're set up as 2 different processes, and the eligibility forms are slightly different, especially we want 2 eligibility forms because they're different projects, different grants, different projects. So we have that separate. And in the end, you're going to need to use 2 different applications anyway. So it's best just to keep those separate from the very beginning for clarity.
Thanks, Morgan.
Again, this is where you upload the budget. I mentioned this earlier. Here's the budget template. So you can even open the templates from the preview PDF form. We ask for your financials, which is pretty standard for funders. So we ask for your financial statement, your audited financial statements, and your operating budget. We review those about, I would say, halfway through the funding cycle. We do take a look at those. So please make sure you upload them. Board governance, we ask for your board roster. And then finally, you just authorize the application and hit submit before the deadline, which is July 31st at noon. Stop sharing that screen and go back to my PowerPoint. Any questions about the grant portal after seeing that demo?
I will offer a quick tip, which is it's super helpful if you go ahead and pop in there and do your eligibility form sooner rather than later. If you do your eligibility form the day of or the day before the application is due, it's possible that we'll miss something along the steps. So just cover your bases and go ahead and do that eligibility form.
Mhm. Thanks, Kate. Jumping back into the presentation, this is our grant budget and our current outstanding obligations for this upcoming fiscal year. The available balance is about 1.2 million, 1.3 million if you round up. And that is split among both funding cycles, not the technical assistance grant, that's separate. But this is going to be both for fall and spring. The board has the authority to split that up however they want. So if they want to spend the whole thing in the fall, they can. Typically what they do is they split it between both funding cycles. There's a question, do you have a link with a letter of commitment template? Yes, I could send you that link. If you are at the point where you're thinking about completing a letter of commitment, I encourage you just to submit the eligibility form, because once you get into the application, all of those links are right there. You don't necessarily have to get ahead of yourself. Here's a funding calendar. This is also on the website and in the grant portal. Applications are due again, and that should say by noon, because the grant portal closes at noon on July 31st. Grantees will be notified and applicants will be notified October 30th. And then the grant period begins January 1, 2027. So that's when the contracts have to be signed by then, the insurance has to be uploaded by then, and you're able to request funding at that time. Frequently asked questions are on our page, our website as well. I encourage you to go view those. Trying to get the actual link you can click. Dropping the link in the chat for you. Just a couple reminders. We've already mentioned all of this, but give yourself enough time to submit that eligibility form, to collaborate with people, get a second set of eyes on it. Don't wait until the last day to start your application, especially with this eligibility form process. It takes us a few days to review them. And like Kate said, the idea meetings can fill up fast, so you want to get on the calendar. And then that gives you time to really think through any suggestions that maybe you're given, and you're not feeling rushed at the last minute. We have a special save the date for you. Kate, do you want to take this slide?
Sure. With our new funding priorities, we thought it might be helpful to offer some just additional assistance. So we're putting together a training with Walther Stack Associates that will give you an opportunity to think through your evaluation process, your outcome process, and how to use the information and data that you already have to demonstrate outcomes in a simple and efficient way. We know that you're busy. We know that often folks at nonprofits are wearing multiple hats. And we just want to support you in figuring out the simplest and easiest and most effective ways to demonstrate the good work that you're doing. So if you would be interested, save the date for the morning of July 29th. We'll do a morning session with Walther Sec. And then for folks who participate in that workshop, we're offering 8 individual organization sessions with Brian and Janelle, 30 minutes each, to just talk through your ideas and your challenges so that you have a thought partner in evaluation and outcome development. So more information is coming, but we'd love to have you join us.
Thanks, Kate. So with that, are there any questions? Any other questions? You all had good ones throughout the presentation.
Yes, actually. Sorry, I'm wondering about whether or not you'd prefer separate idea meetings for both fall funding cycle applications and the technical assistance applications. It seems like you want those pretty separated, so.
That's a great question. I don't mind talking with you about both at the same time in the idea meetings while we're together and we've got time on the calendar. As long as you feel like you can talk about both in the 30-minute time frame, we can just tackle them together. If you feel like you really want extra time, I'm not opposed to you signing up for two. Happy to see your face again. So I'm flexible doing it either way.
Got it. Appreciate it.
Yep.
Well, here's our contact information. If you think of any questions, don't hesitate to reach out. Feel free to call us, email us, explore our website. If you run into any issues, please reach out. This is obviously it's a pilot for our TA grant. So if you run into any issues like links not working or questions not filling in properly or the character limit being a little wonky, again, please reach out. You're not going to offend us by asking us questions or providing feedback in any way.
We do have a little guide to some resources for technical assistance, a guide from the Bridgespan group, a resource on equitable evaluation and outcomes. So check out our website for some additional resources. And then before we wrap up, I would greatly appreciate it if you got what you need from this presentation. Would you give us a quick thumbs up? And if there's anything outstanding or you want to be followed up with individually, you didn't have time for your question this morning, would you put your name and contact information in the chat and we'll follow up with you. Thank you for all the thumbs ups. We appreciate that. We just want to make sure you're getting what you need.
Fantastic. And with that, you all have a nice day. I'll leave this on for just a couple minutes in case anyone wants to drop their contact information in the chat. Thank you all so much.
Happy to see you. Hope you apply. Have a great day.
I have a quick question I just thought of.
Yeah.
Is this gonna be can we have access to this as well?
Yes. Yep. This will be posted online by the end of the week.
Okay.
I'll send you all, you're welcome. I'll send you all an email with a link to the recording as well as a link to the RSVP to the evaluation training.
Thank you.
You're welcome. All right. Have a good day, all.
Oh, sorry,
Hi.
I had one.
Yeah, Joanna.
Do you have any resources for like the evaluations and outcomes before the workshop on the 29th? Anything that might help guide us to better, quantify, I guess, those outcomes and evaluations?
Yeah, there's a short list of resources available on our website. I will look for it real quick and see if I can put hands on it.
I just dropped it in the chat.
Oh,
Kate.
great. Good job.
It's a
So
download, Joanna.
So that's a good place to start.
Oh, okay, great. I see it. Awesome. Okay, thank you so much.
My advice is always not to overthink it. What are you trying to change and how are you going to measure that change? If you're trying to change healthy food access, are you measuring that by how many vegetables are included in your meal service a week? That is sufficient. I think it's just a question of beginning with the end in mind.
Okay. All right. Well, I appreciate your time. Thank you so much.
Sure thing.
Yeah, thank you.
Okay. Nice to see you. Thank you for your time.